So I had another person ask me, Dr. Berg, is it okay to consume butter on a ketogenic diet? I don't want to have a heart attack. Okay, so let's just talk about this. You're not going to get a heart attack by consuming butter. Butter does not increase LDL. Okay, it doesn't. It does increase HDL, the good cholesterol, but even then, even if it did increase LDL, it's not going to be a problem, especially if you're not adding carbohydrates to the butter. Okay. Now, there's 400 different types of fatty acids in butter, so it's a very complex food. 25% of it's monounsaturated fats, 70% it's saturated, 2.3 polyunsaturated fats. It has some cholesterol in there, phospholipids that are needed to build the cell wall. And also realize that your body makes cholesterol. It makes a lot. It makes 3,000 milligrams every single day. Okay, so when you consume cholesterol, your body doesn't have to make as much. One big benefit of butter, and I'm always going to recommend grass-fed butter because it has a lot more nutrition, carotenoids, which is a phytonutrient, and tocopherols, which is a type of vitamin E. But one of the big benefits is butyric acid. Butyric acid is a potent anti-inflammatory. So when you consume butyric acid, you reduce inflammation in the gut. You decrease the risk of polyps. You also improve insulin resistance. So you're actually lessening chances of getting diabetes. It also has the ability to suppress E.coli and salmonella. It's loaded with vitamin A, D, E, and K2. Some people want to know about ghee. What is ghee? Basically, ghee is butter, but they take out the water and the solids, so it's pure butter oil. And it has additional interesting benefits to the colon, especially if you have any damage in the gut. And it even lasts longer. It lasts 6 to 8 months. So, yes, you can consume butter on a ketogenic plan. Just make sure it's grass-fed. So to prevent me from running out of content, I have a new survey. I want to find out what you are interested in. So please fill it out. The link's down below.